and therapeutics research. She is located at the City of Hope, Arcadia, and South Pasadena locations, and she specializes in breast cancer, lung cancer, liver cancer, and immunotherapy. Her interest in oncology has gone back very far. Like many of us, we have a personal connection to cancer, and she does as well. She completed her undergraduate in honors from Stanford University. She received her medical degree at the University of Texas. She completed her residency and fellowship at UCLA. She did immunology research at MD Anderson in Houston. And she also did much work at UCLA before coming to City of Hope. Dr. Wang is fluent in both English and Mandarin and has a passion for helping the community. She is known for building relationships with her patients and all that she serves. So we're just so grateful to have her here today. There is information that Crystal just posted in the chat if you'd like to know where specifically Dr. Wang is located. So Dr. Wang, I'm going to hand it over to you. Thank you so much for being with us.
Great, thank you so much for having me. So today we'll be talking about metastatic breast cancer, pretty broad topics, and touch upon some of the common different treatment options, and then of course leave time afterwards for a question and answer. So let's get to it. Hold on. Oh no. Okay, disclosures. I do not have any financial relationships. So this is a quick overview of our workshop topics that we'll touch upon today. And then again, later on, we can go back and talk about some if you guys have questions for those. So starting off with, what is metastatic breast cancer? And this is a nice introductory slide that is encouraging about how, you know, even though cancer is such a big diagnosis, there's different ways to approach it, and there are support and education options. So what is metastatic breast cancer? Most of you probably already, of course, know this, but it is cancer that's spread from where it has developed. So first from the areas of the breast to other parts of the body, which can include lymph nodes, the skin, other organs like your liver, your lungs, bones, and brain, also known as stage 4 and advanced breast cancer. Okay, so once you've been diagnosed with breast cancer, you know, what is the metastatic breast cancer? What is the next step? So this is probably, you've all already done this, but it is very important to emphasize that you do want to have a healthcare team of doctors, nurses that you can trust and with expertise in breast cancer. You want to be able to have access to clinical trials and new treatments and technology, because that drastically changes how we treat breast cancer. You definitely want to be able to communicate with your doctor and your care team. And this probably is self-explanatory, but you do want to be respected and heard, and know that your doctor and your team understand your goals for your life, so that we can work together. And then of course, you know, where you live, insurance, urgent care. You guys are probably all in the Pasadena area. So pretty local. Okay. Getting a second opinion, that's a very common thing that patients do for metastatic breast cancer. I think that's definitely a good option. And so you should always feel comfortable to get a second opinion, just to be sure. A lot of patients ask me, do they have to get a second opinion? And the answer is no. If you feel comfortable with your treatment team and you trust them, you don't have to. But if you want to, you definitely should be able to as well. And your doctor should encourage that. Okay. And then, you know, for your appointments, it's always good to have a list of your questions so that you know what you want to talk to your doctor about and things that you have concerns about. Pre-COVID, you could bring a friend in. Now every office is different, whether or not you can bring in a relative or friend, but if so, you can often bring someone. Sometimes my patients ask to record our conversation, so you can always ask your doctor if they're comfortable with that, because it could be information overload all at once, and when you go home, you want to think about what they said, so that could be helpful. Specifically for metastatic breast cancer, you want to know what subtype you have, what it means for your treatment. You want to talk about the side effects that you're experiencing and how they're affecting you. And then also, again, about your expectations, your fears, your goals. All of these are important to communicate with your team. Okay, you can definitely talk to your doctor about over-the-counter medications, vitamins, supplements. These are questions I get all the time. And there's a lot of stuff out there. So you want to know what alternative and complementary treatments are good compared with your traditional care, good partnership, and which ones you want to avoid that could potentially interact with it. And then you want to talk about the potential benefits from your medications, and then ask if anything you're taking could, again, interfere with how effective your treatment is. So how is the treatment of metastatic breast cancer different from early stage treatment? Well, one, the goals of the metastatic breast cancer is different because I always tell my patients to think of it as a long-term illness. This is something that you will have with you for the rest of your life. And so the way we want to think about treating it is we want to be able to manage your symptoms, maintain your everyday functioning as best as we can, and really just optimize the length and the quality of life that you have, as well as, of course, prevent it from spreading further, shrinking it down more, and all of those things as well. But the goals are different because we're trying to make this something that you can really live with and enjoy your life with. So most common questions that I get and that you probably discuss with your doctors is the cancer subtype. Breast cancer is a very heterogeneous, meaning that there's lots of different types of breast cancer. So the most common ones are in combination can be hormone positive, ER/PR positive, HER2 positive or negative. You can have combinations of hormone and HER2 positive, and that's what we call triple positive. Or triple negative breast cancer, in which case they do not express ER, PR, or HER2. And treatment is different for each of these types of cancer. So it is very important that you ask your doctor what kind you have and you're familiar with that. Then you ask them about the treatment they recommend, why they recommend it, how to know if the treatment is working. I think that's a really good question you can ask your doctor about. And for metastatic breast cancer, we do things like check your tumor markers, check your blood tests to give an idea of what's going on with the treatment, making sure it's working the right way. And of course, following scans to look at the areas of involvement. You want to know about the side effects of your treatment, the short-term and the long-term effects, and how it could affect you now and later, and how they should be able to, you should be able to talk to your doctor or your team if you do have a side effect. Then you want to know what support services are available, cost issues, and also if clinical trials would be a good idea for you. So treatment options. For metastatic breast cancer, the primary form of treatment is systemic treatment, which means that it is medicine that treats the whole body and not the particular area of tumor. So rather different from early stage breast cancer, where often involves surgery to cut out the main tumor, metastatic cancer has spread. So we want to be able to treat all the areas where the tumor is. So again, these options include hormone therapy, chemotherapy, targeted therapies, immunotherapies, and then clinical trials. Sometimes, though, we will offer things like surgery and radiation, but these would be to treat specific symptoms, not to actually increase your length of life. But this would be if there's significant pain or a really bothersome issue. So your plan will be based on where your disease is, how severe your symptoms are, and then things like your age, your health status, your personal goals. And so your doctor should be able to tailor this for you. Again, it'll also, depend on the subtype of breast cancer you have. And now there's been lots of developments in different other tumor markers and genetic sequencing and testing that we do now to see if there's special treatments that would be targeted for you. And PD-L1 expression for our triple negative breast cancers to see if immunotherapy would be something that would be of benefit. So this is a nice chart of different treatment options. I'll go into them more and see, once you know what biomarkers and what type of breast cancer you have, you can see the different options that are available. Sometimes we do sequentially, like hormone therapy first, and then chemotherapy, and sometimes we do them together like chemo and immunotherapy. So it just depends on the type of cancer that you have and where you are in your stage of treatment. Okay, so I'm going to now go over a bunch of treatment options, and you all probably are on some of these, or have gone through some of these. It's going to be a quick overview, but if you have specific questions, we can go back and talk about it afterwards. So treatment options for hormone positive metastatic breast cancer, we have our selective estrogen receptor modulators, which is tamoxifen. And then in our postmenopausal patients, we have aromatase inhibitors, the anastrozole, exemestane, and letrozole. There's 3 different, these are all equally effective, but slightly different side effects for different people. So then there's also fulvestrant, which is a estrogen downregulator. This is an injection that is given in the butt. And then there's other injections that can be given to block the hormones for our premenopausal women that kind of shuts down your ovaries and essentially makes you postmenopausal. So these are gaserelin, or more commonly used is Lupron. With metastatic breast cancer that's hormone positive, what's really changed in the last 10 years is the addition of these CD46K inhibitors, palbociclib, ribociclib, abemaciclib, to have really dramatically improved response in hormone positive breast cancers. And the best part is they're pills. So it's very tolerable and very easy for patients to take. Later lines of therapy include mTOR inhibitor, everolimus, which is also a pill. And then for patients with this special PI3K kinase mutation, there's alpelisib, which is given with the fulvestrant injection. So when you're on hormone therapy, you want to talk to your doctor again about your menopausal status, if you're pre or postmenopausal, hormone receptor, ER/PR, and also past hormone treatments that you've had, and then the different side effects that you experience. So the next broad category is treatment options for HER2 positive breast cancer. So again, this is a different subtype of breast cancer, though some patients can be hormone and HER2 positive. So these are more focusing on targeted treatments because patients with HER2 positive breast cancers have HER2 genetic changes. So there's treatments that directly treat these HER2 mutated cells, which are the cancer cells most often. So the classic ones have been the monoclonal antibodies. Initially, it's been Herceptin, trastuzumab, and now there's biosimilars on the market. Newer one is pertuzumab that has been added. Often these two are used together. Even newer, though, we have the tyrosine kinase inhibitors, also for HER2. These are pill treatments, lapatinib, neratinib, and tucatinib, which is one of our new ones in the last few years that has really good brain activity too to help protect the brain. And then we also have new antibody drug conjugates, which means that they match up HER2 antibodies with some chemo drugs. So it's kind of like chemo that's directed at HER2 cells. And this is medications like TDM1, which is adagrasib and emmetacine, and famtrastuzumab deruxtecan, which is in HER2. These are all pretty brand new drugs that have come out in the last year or so. Okay, so what happens after you've exhausted HER2 or hormone therapy options? Then we have chemotherapy, traditional chemotherapy. In metastatic breast cancer, this is different from early stage where you do combinations of chemo. Metastatic, our strategy usually is to do one drug at a time, though sometimes we do use 2 drugs. And again, the reason is we want to really minimize your side effects while maximizing efficacy. So traditionally, in breast cancer, we use anthracyclines, doxorubicin, or there's also a different liposomal form of it that we use. The taxanes, which are docetaxel, paclitaxel, and nab-paclitaxel, which is a Abraxane that you may have used, and then platinum agents, including carboplatinum. Other chemos that are used are 5-FU antimetabolites, capecitabine, gemcitabine, and then this other category called microtubule inhibitors that affect the DNA of the tumors. So these are the drugs eribulin, axapolone, and vinorelbine. So the issues to discuss with your doctor regarding chemo are, should you use single or combination chemotherapy, which I just talked about? Also, how often are these treatments? And can there be any modifications in the frequency of it? Are there oral agents that are available? And then any other medical problems that you have that may affect your tolerance and safety. And then, of course, things like cost, side effect management, and if there are any clinical trials that are appropriate for you. Newer targeted therapies that are out also include therapies for people who have specific genetic changes, such as the BRCA1/2 mutation. There's these drugs called PARP inhibitors that are particularly effective for patients with metastatic breast cancer and a BRCA1/2 mutation. Also, there's a newer antibody drug conjugate called sacituzumab that is also used in triple negative and some hormone positive breast cancers. So metastatic breast cancer, that field is constantly developing. There's lots of new drugs. Sure, if I give this talk again in a year, I'll have new things to add on to it. And I think that those are really good, good reasons to have good hope while you're managing your cancer. So with targeted therapy, you want to talk to your doctor again about the HER2 status, your other biomarkers, other available therapies, and clinical trials. Nowadays, with metastatic breast cancer, we do often recommend genetic sequencing to get more of this kind of information. So it's definitely something I would encourage you to talk to your doctor to see if you'd be eligible for as well. And the last treatment option is immunotherapy. This is also pretty new. In breast cancer, this has been shown only to be effective in triple negative patients. So when my hormone positive patients ask about these, unfortunately, it doesn't seem to be working that well in hormone and HER2. So only triple negative. But this is a different type of therapy because it boosts the immune system to fight the cancer. And it is dependent on whether or not you have this PD-L1 expression. So you should always ask your doctor to test your tumor for PD-L1, because if so, you can have immunotherapy, pembrolizumab, added in. It is used in combination with chemotherapy. So it's not by itself in breast cancer, it's with chemotherapy. And then lastly, you should always ask your doctors about clinical trials. The goal of clinical trials is to find better ways to treat breast cancer. And many people do get treatment through clinical trials. So my philosophy is, if there is a great trial that offers standard of care plus something else, or there's good data that it could be better than standard of care, it would be something to talk to your doctor about trying. If the data is unknown and it does not offer standard of care, I typically do not offer patients the clinical trial unless it includes a standard of care or there's some potential for improvement. But this is definitely something to talk to your doctor about. And you can also be proactive and search on the, I especially like the cancer.gov clinical trials link. Okay, so next is managing side effects. And we will talk, this is a big topic for breast cancer. So a big point is that not everyone experiences every side effect. So your doctor is going to give you a whole list of side effects, and if you Google online, it's even worse. But everybody experiences different things. So it's good to know about them, but don't freak yourself out about it. See what you experience, and then ask your doctor about how to manage it. Most common side effects of treatment for breast cancer are hair loss, nausea, vomiting, diarrhea, GI issues, difficulty eating, weight loss, appetite changes, mouth sores, fatigue, sleep issues, changes in your skin and nails, swelling in your lymph nodes and other areas like your legs, neuropathy, which is numbness and tingling, as well as pain in your hands and feet, hot flashes, night sweats, sexual side effects, and also just behavioral, cognitive, and emotional changes. Immunotherapy side effects are a little bit more different. They are often more mild, but in less than 5%, they can actually be severe and life-threatening as well. And if you have immunotherapy side effects early, there's ways that these can be reversed and managed, often with steroids. So the most common side effects are immune system mediated. So you can get things like itchiness of your skin, like a rash. Some people can get trouble breathing or coughing. You can get visual symptoms, stomach issues, also diarrhea, cramping, fever, sudden fatigue sometimes happens also, headaches, blood pressure, and less often urination issues, but you could also have the same problems thinking and remembering things. So the next part to talk about is in addition to all the medications, the chemotherapy, the immunotherapy, all those things I've talked about, there's also the concept of palliative and supportive care, which is really important. And many people think that this is the same as hospice, but it's actually not. It is something that can be done in conjunction with all of our chemo and active treatments, but the focus is different. They're focusing on relief from your symptoms, the pain, the stress, and it's provided by professionals who specialize in palliative care. So they work with oncologists like myself, and to really so that we can take care of your whole body and be able to support you and whatever side effects that you may be having. They help you focus on what's important to you. And so again, it's not the same as hospice. You know, hospice can be a part of palliative care at the very end when you decide you don't want any more active treatments against the cancer, but palliative care is something that you can receive in conjunction with your treatments. So I do encourage you all to look into this if you have not already. And palliative treatments, so I touched upon this earlier, but this is, we talked about how for metastatic breast cancer, the mainstay of treatments is chemotherapy or systemic treatment. But palliative treatments is surgery. And sometimes surgery is done for metastatic breast cancer. If you have a large breast mass that is extremely painful or bleeding or causing problems, surgery can be done sometimes to decrease that pain and discomfort. But at the same time, after the surgery, you're going to still need the total body type of treatment. Other common things we use are radiation therapy, and this is most commonly in the bones because it can really help decrease pain in the bones or fractures from cancer in the bones, and also in the brain. One big side effect of all metastatic breast cancer treatments is going to be bone loss or weakness, and that can be from the cancer, it can be from the hormone therapy or early menopause, and from the chemotherapy. So your doctor will use something called a DEXA bone scan to assess this. And depending on the results, then there are medications that they may recommend to strengthen your bones. Fundamentally is calcium and vitamin D supplements, but there are also other bone strengthening medications like the bisphosphonates, IV or injections that can help. And you want to avoid things of high risk of injury like horseback riding, skiing, and those kinds of things if your bone density is severely low. Again, this goes into the bone strengthening medications. So your doctor may be recommending that you be on something called Zometa, which is alendronic acid, or denosumab, because these will help the bones, prevent the bones from losing calcium, decrease the risk of fractures, and actually helps protect and strengthen bones from more cancer. Okay, so the last thing I'm talking about is just how to live and cope with metastatic breast cancer. And the challenges of living with metastatic breast cancer that every woman faces at one point or another is loss of hope, loss of control, living with uncertainty, you feel alone. And these are very, very normal things to experience. So the members of the Metastatic Breast Cancer Registry reported these as the major areas of concern or distress, worrying about the future, what lies ahead, feeling too tired to do what you need or want to do, concerns for finances, concerns about what to eat, how to maintain your nutrition, your mobility, how to move around in your house and do what you normally do. Of course, concerns about your family, friends, interrupt sleep issues, whether or not you can work, and how your home life is going to be with it, as well as pain, discomfort. And these are the biggest ones that our patients are experience. So how to face it, I know it's something that's easy to say, but it is true that trying to be positive or optimistic or hopeful is something that is good. It doesn't mean that you don't feel negative emotions, but it can help you cope with this. So people with metastatic breast cancer and your families, we encourage you to have expectations about your cancer and to know that you're going to deal with this for the rest of your life, but you can still be positive with your treatment plan, with that. And that can help you make good decisions about your cancer care and moving forward. It can also actually lead to a better quality of life during this time. So one thing we encourage is to really be able to express your emotions rather than, keep it all inside, because that can help improve your physical, mental health, give you better ability to control your emotions. And also, these are ways to help you cope and interact with your family. Repressing your emotions, of course, can lead to aggressiveness, hostility, further alienation and isolation, as well as sometimes even irresponsible, impulsive actions. So of course, I send work groups, and you can talk with your family and friends. There's groups for your family and friends as well. There's also online resources. There are spiritual advisors. You can look into spiritual advisors, mental health professionals, and different ways of expressing yourself: art, music, writing, exercise, mind-body programs for stress relief. So if you need help, please do not be afraid to reach out to your doctor and to your care team, because there are resources out there. Ways to take care of yourself: nutrition, exercise, social support, hobbies, spiritual practice, connecting with other patients or other people who have gone through this before is really tremendously helpful. And then just processing your emotions, like we're talking about, journal, doing whatever activities you enjoy with. And the last thing is, part of something that's important that I don't know if everybody knows about is it's important to have things like advanced care planning done. And it can be done at any time and for anyone, but it's good just to have it ready, a living will or an advanced directive, so that your doctors know what kind of medical care you want if it should happen that suddenly you're in the hospital and you can't express or speak for yourself or whatever circumstance. It's also good to have a DPOA, or durable power of attorney, in the case that you need that someone to make decisions for you. So these are just things to keep in the back of your mind that are important. And it doesn't mean that you'll need to enact upon this anytime soon, but it is important documents to have. So moving forward, this is a great quote from a patient. My life has not stopped because I've been diagnosed with metastatic breast cancer. I pace myself and I'm passionate about pursuing my dreams, and I can't consider the cancer aspect of my life as a chronic condition, thorn in my side, but it will never define who I am. So that's from a patient. Okay, so actually I sped through these slides because I wanted to make sure there's time for questions. If anyone has any questions, I'm happy to go back, or you can just start asking whatever questions you'd like, whatever you guys want.